elbow articulations, and the radius. Welcome back to Lecture 4 of our Upper Limb series. Today we are focusing on the complex mechanics of the elbow and the critical landmarks of the radius that you will frequently encounter in clinical practice and exams. Section 1. The elbow articulation. The elbow isn't just one simple hinge, it is composed of 3 articular surfaces. To keep these straight, think of them as 6 distinct structures working in pairs. Humeroradial. The head of the radius articulates with the capitulum of the humerus. Humeroulnar. The trochlear notch of the ulnar articulates with the trochlea of the humerus. Olecranon. Interface. The olecranon process of the ulnar fits into the olecranon fossa of the humerus posteriorly. Section 2. Radioulnar joints and movement. To achieve supination and pronation, the radius and ulnar articulate with each other at 2 points. Superior, proximal, radioulnar joint. This sits between the head of the radius and the radial notch of the ulnar. It is held in place by the annular ligament, which supports the radial head. Inferior, distal. Radioulnar joint. This is located between the head of the ulnar and the ulnar notch of the radius. Here we must mention the very common elbow issue happens to children, the pulled elbow. In pediatric cases, a sudden pulling force on a child's arm can cause the radial head to slip out of the annular ligament. This is a common subluxation you'll see in the ER. Section 3. Landmark of the distal radius. Lister's tubercle. Moving down to the wrist joint, there is a vital landmark on the distal radius called Lister's tubercle. This bony prominence acts as a pulley for the Extensor Pollicis Longus, EPL, tendon. Clinically, this is significant because the EPL tendon wraps around this tubercle and can become trapped or even rupture following distal radius fractures. That concludes this lesson. Now up to the next one.